Welcome back to another installment of Ultrasound in Practice. This month's episode is called The Sonographer and the Sea. Let's meet our patient. He's a 25-year-old healthy male who presents to the emergency department with the chief complaint of right-sided chest pain and shortness of breath after he smoked some marijuana earlier. His vital signs show a little tachycardia, but otherwise is normal. Now, of course, we're thinking, does he have a pneumothorax, and how are we going to figure this out? Now, we could do a chest x-ray, but of course this is an ultrasound lecture. So let's talk about a meta-analysis that was done in trauma patients, of course. But it does show that ultrasound was a clear winner in sensitivity. Specificity is roughly equal. So let's talk about technique. We're going to use a linear probe in the mid-clavicular line. We're going to have it in the sagittal orientation with the indicator probe towards the head. We start at the top and we start scanning our way down to the bottom. And we do this bilaterally. It's important to note on the left side you may need to be a little bit more lateral to avoid getting in contact with the heart. This is what we'll see, and let's review some anatomy. For those who like Netter, we'll review this image here, but I think it's more helpful to take a look at the actual ultrasound image and colorize it. You have the skin, muscle, and ribs, and these are non-static, non-moving structures with the lung underneath. Of course, we know lung is filled with air, and air is the enemy of ultrasound, so it's not going to give much detail past the visceral parietal pleural interface. So what would you expect to see for normal anatomy is right here. We see lung sliding. It almost looks like ants on a string. We also see these artifacts called comet tails, these little spikes that come off and flash briefly. Here's an example of one frozen. So let's take a look at this example. Is this normal? We're not seeing the lung sliding that well, nor are we seeing these comet tails. So we have a little trick up our sleeve called M mode, motion mode. You click this button and it'll split the screen like this. It'll drop down a linear cursor and you select an area between two rib spaces. Now when you hit M mode button again, it'll march out the pixels along this line with respect to time. For example, now the skin, subcutaneous, and muscle layers are static, so it's going to produce a linear texture. The lung, which is filled with air, will give a speckled texture. It almost looks like you're sitting on the seashore looking at the horizon. They call this a seashore sign, and it's normal. What would you see if it's a pneumothorax? Now, you wouldn't get that speckled pattern. It would look pretty static all the way throughout, and that's called the barcode sign. That's abnormal and indicates pneumothorax. So in conclusion, our patient had a normal ultrasound and was eventually discharged to home. If it matters, he also got a chest x-ray, also normal. Ultrasound can be superior to chest x-ray in detection of pneumothorax, and there are other methods for detecting pneumothorax that we didn't cover, such as lung point sign, A-lines, and power Doppler. But we're happy to talk about those in person if you ask us. Thank you.